Hello everyone, now let us see summary of structural and functional classifications of joints. So here you can see the structural classification, description, functional classification and the example. First of all, we will be discussing about fibrous joints. Fibrous joints that do not have synovial cavity. The articulating bones are held together by fibrous connective tissue. The first type of fibrous joint is a suture. Articulating bones are united by a thin layer of dense, irregular connective tissue found between skull bones. With age, some sutures replaced by the Synostosis, that is, separate cranial bones fuse into a single bone. Examples: the functional classification of a suture is Synarthrosis, that is immovable, and amphiarthrosis, that is slightly movable. Sutures can be of two types based upon their function. They can be immovable or slightly movable. If they are immovable, it is called as synarthrosis. If they are slightly movable, they are called as amphiarthrosis. Example of a suture is coronal suture. The next type of fibrous joint is syndesmosis. In syndesmosis, the articulating bones are united by more dense irregular. In suture, it is a thin layer of dense irregular. Here it is more dense irregular connective tissue, usually a ligament. The articulating bones are usually united by a ligament in syndesmosis. And they are amphiarthrosis, that is, they are slightly movable. Example is distal tibiofibular joint is an example of syndesmosis. Distal tibiofibular joint is an example of syndesmosis. The next type of fibrous joint is interosseous membrane. Here, the articulating bones are united by substantial sheet of dense irregular connective tissue. And they are also amphiarthrosis, that is slightly movable. Example of interosseous membrane is between tibia and fibula. So interosseous membrane is also a fibrous joint, remember. The next type of joint is cartilaginous joint. In cartilaginous joint, also there is no synovial cavity. Articulating bones are united by hyaline cartilage or fibrocartilage. In fibrous joints, their articulating bones are held together by fibrous connective tissue. In cartilaginous joints, the articulating bones are held together or united by hyaline cartilage or fibrocartilage. Hence the name cartilaginous. The first type of cartilaginous joint is Synchondrosis. Chondro means cartilage, remember. Synchondrosis. Chondro means cartilage. The connecting material is hyaline cartilage, becomes Synostosis when bone elongation ceases. Synchondrosis, they become Synostosis when the bone elongation ceases. And they are synarthrosis, that is immovable joints. Synchondrosis joints are immovable joints. Example are epiphyseal plate between diaphysis and epiphysis of a long bone. The epiphyseal plate between the diaphysis and epiphysis of a long bone is a synchondrosis. That is a cartilaginous joint. The next type of cartilaginous joint is symphysis. Here the connecting material is broad flat disc of fibrocartilage. Previously it is hyaline cartilage. Now it is broad flat disc of fibrocartilage. And they are amphiarthrosis, that is slightly movable. Symphysis are amphiarthrosis. Example is pubic symphysis and intervertebral joints. They come under symphysis joints. Next type of joint is synovial joints. These are very important. Synovial joints. They are characterized by synovial cavity. Hence the name synovial joints. The synovial joints are characterized by synovial cavity, articular cartilage and articular capsule, and may contain accessory ligaments, articular discs and bursa. These are the characteristic features of all types of synovial joints. The first type of synovial joint is plane. Here, articulated surfaces are flat or slightly curved. In plane joint, the articulated surfaces are flat or slightly curved. Many biaxial diarthrosis, that is freely movable, back and forth and side to side movements, and some triaxial diarthrosis, that is back and forth, side to side and rotation. They are examples of plane joint. Coming to the examples, intercarpal, intertarsal, sternocostal, that is between the sternum and the second to seventh pair of ribs, and the vertebrocostal joints. All these things are examples of plane joints. Intercarpal, intertarsal, sternocostal and vertebrocostal. The next type of synovial joint is hinge joint. In hinge joint, the convex surface fits into concave surface. Convex surface fits into a concave surface. Functional classification, they are uniaxial diarthrosis. That is, they aid in flexion and extension only. Hinge joint aids in only flexion and extension. Example is, knee joint is a modified hinge joint. Elbow, ankle and interphalangeal joints. These are hinge joints. The next type of synovial joint is pivot joint. Here, the rounded or pointed surface fits into a ring formed partly by bone and partly by ligament. Rounded or pointed surface fits into a ring formed partly by a bone and partly by a ligament. And the functional classification of pivot joint is uniaxial diarthrosis. That is, they aid in rotation. Example of pivot joint are atlantoaxial and radioulnar joints. Atlantoaxial and radioulnar joints are pivot joints. The next type of synovial joint is condyloid. Condyloid joint. Here, oval-shaped projection fits into oval-shaped depression. Hence the name condyloid. Oval-shaped projection fits into oval-shaped depression. Functional classification, they are biaxial diarthrosis. They aid in flexion, extension, abduction and adduction. Example are radiocarpal and metacarpophalangeal joints. These are example of condyloid joints. The next is saddle joint. Here the articular surface of one bone is saddle shaped and the articular surface of the other bone sits in the saddle. And functional classification, they are also biaxial. That is, they aid in flexion, extension, abduction and adduction. Examples of saddle joints are carpo-metacarpal joints between trapezium and metacarpal joint of thumb. The next is ball and socket joint. Ball-like surface fits into cup-like depression. Hence the name ball and socket. The ball-like surface fits into cup-like depression. They are triaxial orthosis. Ball and socket are triaxial orthosis. They aid in flexion, extension, abduction, adduction and rotation. Examples of ball and socket joints are shoulder and hip joints. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.